Good morning, Mr. Jones. How are you?
Good.
Good. I'm Rebecca Deatley. I'm an occupational therapy student at the University of St. Augustine. I'm here today just to do your occupational therapy evaluation that your doctor ordered. We're just going to address some of the symptoms that you're feeling that's keeping you from doing all the things that you want and need to do, okay? I understand you suffered a stroke during your coronary bypass surgery about 7 days ago. Yes, and that left you with left upper extremity hemiparesis. So you can't move your left shoulder, arm, hand at all?
Correct.
Okay. All right. How are you as far as your pain level goes today? Are you feeling any pain?
I have a headache.
You have a headache? Okay, so on a scale of 1 through 10, 1 being you feel great, 10 being you want to call 911 right now, how bad is the pain?
About a 4. I think I need to eat.
You need to eat. Okay. Well, as soon as we're done with this, we'll make sure. So you haven't had breakfast or anything yet? Okay. It's a little late, so we need to make sure we get that for you. Do you know where you are today?
Yes.
Okay, where are you?
The hospital.
You're at the hospital. And why exactly are you here?
I had a stroke.
Correct. Okay, you did. You had a stroke. What month is it? What month are we in?
December.
Correct. And when is your birthday?
My birthday's 12/4/1962.
Perfect. Okay, great. Now, currently, let's see, you have sternal precautions, and that's because you have an incision in your chest from your surgery. I see here in your chart that you're on a nectar consistency liquid diet. Are you having problems swallowing?
Sometimes.
Sometimes. Did you have that before the surgery or before the stroke?
Yes.
Or you did before then? Okay. For how long would you say that's been going on, and did you see a doctor for that?
Yeah, I have. A few
Yeah.
months.
A few months. But no diagnosis or anything? Okay. We'll take a further look at that. We'll probably have you speak to somebody in our speech language pathology department as well. Okay, now the only other surgery that you had was a tonsillectomy. Do you remember how long ago you had that?
1990.
1990. And you've been healthy in between, nothing else? Okay,
Right.
good. You also have some orthostatic hypotension. So when you stand up from sitting or lying down, you get dizzy?
Sometimes.
Just sometimes. Has it become worse since after the stroke? Not worse? Okay. And you also have hypertension and arthritis. Are you taking any medication for your blood pressure?
Synopral.
Lisinopril. Do you know how many milligrams?
No.
Okay, we'll check. That's not a problem. What about for your arthritis?
Motrin. Advil.
Advil daily or just as needed?
As needed.
As needed. Okay. Now, you live at home with your spouse?
Correct. My wife.
Your wife. Okay, good. You live in a first-story condo, and you have a 5-pound dog. Do you have any steps that lead into the condo? No? Okay. There are no stairs. In the home, do you have a bathtub or a shower?
Shower.
Now, do you have to step down into the shower? You don't. Are there any grab bars in the shower?
Yeah.
Okay, that's something we may want to look at prior to discharging. Just we'll see how your progression goes, but those might come in handy just to give you some stability at home. Prior to your stroke, were you having or were using any assistive equipment like a cane or a walker? You've never had to use anything like that? Were you driving yourself?
Yes.
On your own, so you're independent with your driving? Now, how about your wife? Does she work?
She's retired.
She's retired, so she's home during the day and the
Correct.
evenings. So when you go home, she'll be there to help you with anything you might need assistance. Help maybe drive you to doctor's appointments.
Right.
Great, that's very good. You're very fortunate to have that. Now, have you ever fallen before?
No.
No history of falls. Okay. We spoke earlier a little bit about your sternal precautions. Can you repeat those to me?
I'm not supposed to lift anything greater than a gallon of milk.
Correct.
Push or pull my arms reach across my body.
Correct. Okay.
Is there one more?
There's a couple more.
Oh, I'm not supposed to drive,
Right until.
so I'm clear.
Okay.
And I'm not supposed to extend or flex my shoulders 90 degrees.
That's 90 degrees. Perfect. That is perfect. You just don't want anything pulling on that incision area that will open it or irritate it. Okay? All right. Now, do you wear glasses or contacts? So your vision is good. Okay. Do you see the clock that's across the room from us?
Yes.
Can you tell me what time it is?
10:15.
Perfect. It is 10:15. Now let me ask you something. If there was a fire in the building, what would be the first thing that you would do?
Call 911.
Exactly. Okay. Very good. What I'm going to do now, Mr. Jones, I'm just going to ask you a series of questions that we ask all of our patients, and it's just to see so we can assess what life is like at home for you in regards to your everyday activities and responsibilities. Who does the grocery shopping in your home?
We both do.
You and your wife go and you go do together, and
Yes.
you drive the car to the grocery store?
Publix.
To Publix. Okay, good. Who does the chores around the house, like say the cleaning and the laundry?
We both do.
You share the responsibilities?
My wife does most of them.
Does she? Okay. Alrighty. And like I said before, I know prior to the stroke you drove yourself independently. Okay. As far as taking the medications that you have to take every day, do you need any help remembering which medications to take? Does your wife set that up for you? Do you take care of it yourself?
Organized in a pill bottle
In a pill?
container.
Oh, okay. Good. That's good. Okay, and who is responsible for taking care of the household's finances?
My wife does.
Your wife does all of that. Okay. What we're going to do now is I just want to do a manual muscle test and see exactly how weak or how strong you are, and obviously taking into consideration your left arm. But what we're going to do is I want to see how you would transfer yourself from the bed to the chair. Before we do that, though, I just want to put a safety belt on you just because I know that you have some issues with when you stand up, getting a little bit dizzy. Okay, so I'm just going to put this belt on you. Oops, I had it the wrong way. Sorry. So I'm going to hold on to you just in case you are to get dizzy, but I just want to see how you're going to go ahead and transfer yourself to this chair, okay? Oh, okay. You feel dizzy?
I'm fine.
Good. Okay, have
Yeah.
a seat. Very good. You feel okay?
I'm fine.
Okay, good. Well, that was pretty good. So you did that very well. What I'm going to do now is I'm just going to do the manual muscle test, okay? We'll start out with your unaffected arm. So can you hold your arm out to the side like that? Very good. Now I'm going to push up. Hold, don't let me move you. Good. Hold, don't let me move you. Okay. Can you hold your hand in front of you like this? Hold, don't let me move you. Hold, don't let me move you. Okay. Now, squeeze my fingers as hard as you can. Great. Okay. Now, can you touch your pointer finger to each one of your fingers like this? Great. Okay. We're just going to see what you have in your left arm, okay? Can you even attempt to put your arm out at all? Nothing. Okay. And how about, can you lift it up at all? No. Okay. Can you squeeze my fingers? Just a little bit. And can you try to touch your fingers? Okay, well we're going to work on that for sure, okay? I'm just going to check your leg strength as well. Is that okay? Okay, I'm going to put my arm underneath here and hold, don't let me move you. Okay. Hold, don't let me move you. Hold, don't let me move you. Okay, flex your toe up. Hold, don't let me move you. Hold, don't let me move you. Okay, let's just try this one too. Hold, don't let me move you. Hold, don't let me move you. Don't let me move you. Oh, don't let me move you. Don't let me push. Don't let me push. Okay, very good. Got great strength in your legs and in your unaffected arms. That's good. Now, right now, how much help do you feel like you need to take off your pants? Are you able to do that on your own?
Yeah, I can do that.
You can? You just use, how do you do it?
In my right arm.
Your right arm, okay. And how about taking off your shirt?
It's a little more difficult.
A little more difficult. Have you been having help with that?
Yes.
Okay. What about bathing in the shower?
I've been doing it. Just
On your own? Have
takes
you
me
been
a little
using
longer.
Have they given you a shower chair or anything to
Yes.
sit in? That probably helps, okay. How about your grooming? Are you able to brush your teeth and comb your hair?
Yes.
How are you doing that?
In my right arm.
Everything with your right arm, okay. And eating, I know you're on the Nectar Consistency diet, but you're feeding yourself.
Correct.
Okay, all right. I'm going to also just give you a quick mobility assessment. And again, just to reiterate, you told me earlier you had not used any kind of assistive devices at home. Okay. I'm going to ask you to just shake my hand. Okay, great, good, relax. With your right leg first, can you lift your leg out and point your toe? Okay, and now your left leg, point your toe. Okay, I'm going to ask you now, and you don't have to stand up all the way if you don't feel comfortable, but I want you to stand up and I'm going to count to 5, okay? And I want to make sure that you have enough endurance to stand for 5 seconds, okay? So on the count of 3, let's do that. Okay, 1, 2, and 3. Feel okay?
Fine.
Not lightheaded?
Yeah, I'm good.
1, 2, 3, 4, 5. Okay, go ahead and have a seat. Good, you feel okay?
Fine.
Great. Okay, you did that well. Last thing after, just give you a second to relax, but we're going to ask you to stand up. I want you just to march in place. Then I'm going to ask you to take a step forward, step back, step forward, a step back. And again, I'm going to hold on to you just to make sure you keep your balance, okay? You ready? Is that
Yes.
a long enough break? Okay, let's try that. On the count of 3. 1, 2, 3, up. Feel okay? Let's march in place. Very good. Okay, let's move over. Can you take a step to the side for me? Okay, I want you to step forward. Step back. The opposite leg. Step forward. And step back. Feel okay?
Good.
Very good. Okay, let's go back to the chair. Sit down. How do you feel?
Good. A little dizzy.
You're a little dizzy? You feel okay though?
I need to eat.
Okay, alright. We are going to get you food. We're almost done. Well, from that assessment, it looks like I think you're at a number 4, which is independent, so that's really good. But I want to make sure anytime that you're going to get out of your hospital bed, you don't attempt to do it at home or alone, even when you go to the bathroom. We're always going to have the call bell there. I want you to make sure that you call one of us, a nurse, anybody to help to assist you to get up, okay? Call, don't fall. That's what we say, okay? And in closing, I just want to ask you, what are the 3 main goals that you want to achieve while
I
you're
want to
here?
play with my dog again.
You want to play with your dog again? I don't blame you. Okay, that's a
I
good
need to
one.
get back to work.
Go back to work. Okay.
And I like to build model airplanes.
Okay. All right. Well, those are all great goals. I really think we can do some activities to get you back to where you were. I mean,
Thank you.
those are our goals too. We want you to enjoy, an independent lifestyle like you did before this incident. Okay. So we'll be working with you on your left upper extremities, helping you increase your strength, your coordination, your endurance, to get you back to doing all those things that you once did. I know the stroke has made it a little difficult for you to grasp things. You're a little shaky, you get a little bit tired. We're going to be here for you. I'm working on all those things. And I will be back tomorrow morning, and we will address all these symptoms, and we're going to put a plan together and start on your occupational therapy to get you back to being you, okay?
Great.
I am going to leave you with some homework, if you don't mind. I am going to leave this ball with you, and what I want you to do when you're watching TV, when you're just relaxing in bed, I want you to put this in your left hand. Okay, good. And I just want you to try to squeeze it as best as you can, okay? And even if you use your other hand, your good hand, to try to squeeze it, okay? Just to try to rebuild that pathway in your brain of what squeezing is, okay? You don't have to overdo it. Like I said, just when you're watching TV, keep it on your tray and pick it up and do it, for a few minutes at a time. I'm also going to ask your nurse, when she comes in and to give you your medication, I want you, with your left hand, to try to take each pill out of the container, okay, for her. So that's going to help you, work on your fine motor skills, your pinching and your grasping. Okay, so those are 2 little homework assignments, but I will be back in the morning, and we'll get your therapy going, and hopefully on the road to getting you back home and independent again, okay? And before you're discharged, we will talk at that point whether or not we think that you need any kind of assistive devices at home, whether it's like a shower chair, raised toilet seat, maybe a quad cane for some stability. And then we'll also assess whether or not we think that maybe outpatient occupational therapy will benefit you too once you get home. Obviously, when you're here at the hospital, though, we'll be working with you. Okay, Mr. Jones?
Yes.
It's been a pleasure meeting you. I look forward to working with you. Why don't we get you back into bed where you're comfortable, and I'm going to make sure that they bring you your breakfast, okay? So let's help you get back up into bed. Okay, on the count of 3. 1, 2, 3. Good. Okay. Down.
Thank you.
Good. Do you want to lay down, or are you good?
I'm good, thank you.
Okay. Here's your call bell.
Thank you.
Okay. I will see you tomorrow morning.
Thank you.